I'd like to formally welcome everyone to the third webinar in our series on COVID. This one specifically about applying to Cardiothoracic Fellowship in the COVID era. I'd also like to welcome our esteemed panelists. First is Dr. Vaporsian, who is at MD Anderson Cancer Center, who is the Thoracic Surgery Director Association President, and hopefully on shortly will be Dr. Carpenter, who is at UT San Antonio, Program Director there, and also President-elect of the TSDA. As far as our trainee panelists, Tony Moser is a current fellow at Northwestern. He is also the Thoracic Surgery Resident Association Treasurer this year. Yihan Lin is a current fellow at Colorado and is on the TSRA Executive Committee. And then we have two folks, Kunal Patel, who's a Chief President at MUSC, who just went through the half in-person, half virtual interview format at the beginning of the COVID crisis. And he has matched and will be coming to join us at UVA next year, and Kendall Lawrence, who is a Chief Resident at Cornell and also just went through the match and will be a fellow at Penn next year. Joining me in moderating is Dr. Brett Starr, who is the TSRA representative from the ACS RAS group, and a member of our executive committee who's joining us from East Carolina University. So Brett, welcome. Panelists, thank you guys so much for attending. With no further ado, maybe we'll just get it kicked off with a question for Dr. Vaporsian. So how has COVID changed the fellowship interview process? Do people need to be interviewing at more programs, applying more widely? What are your thoughts on this?
So in terms of how it's changed the interview process, that kind of goes without saying, that we are not going to have on-site interviews. Most programs won't allow their trainees to travel anyway. And the programs that do allow them to travel may have restrictions placed on them that are difficult to maintain and adhere to. In addition, we as faculty may not be allowed to bring in external candidates and visitors in such a large quantity or fashion. So to level the playing field, the TSDA is asking that everybody, consider not doing any sort of live interview, even if you have the capacity, you happen to be in an area where they allow it, so that all trainees are given an equal measure and there's no outliers. We were talking just before, and we've talked about it as well, at the TSDA general session, which was 2 weeks ago, which we held, normally would be held at a meeting, but we held it in September. And one of the topics we discussed is how to conduct interviews in this situation. And we gave talks to all of the program directors and program coordinators and hints about how things were done. We had 3 separate speakers, and everybody sort of agreed that you actually can get a very good assessment of a trainee through a virtual interview. You can do it pretty much the same way it was done before. Some surveys have already been done of applicants who went through the process, and a pretty uniform message came back, and that was that individuals who are doing the interviewing actually are the ones who lose out, because they have less of an opportunity to talk in an unstructured fashion with the existing trainees who are there. They don't get to walk around. They don't get to have those offhanded conversations with, say, nurses or other individuals in the program. And also, especially since the vast majority of our trainees have spouses, the inability to assess the environment, all right?
Yeah,
and look around the city and see what it's like to live here and that. And so that's a huge hardship that's placed on the applicant. From my side of the fence, I get a good view. I get more time with the applicant. I get to assess them with lots more questions. So I don't see it being a problem on our side, but I do see it as going to have to be an issue. After a few years of this, it'll become the new norm, so nobody will know the difference. But for now, I think people who've done it both ways will see the difference.
So Dr. Paporsian, given that change and that you feel like the burden falls on the applicant side, how do you think that applicants should do their homework and prepare for this kind of new setting?
So one of the talks that we gave was beefing up your website, because a lot of trainees go to the website. And one of the things that a good website needs on it is access to the trainees, right? How can you contact former trainees and current trainees? We actually did this as a quality improvement project for one of my trainees. We looked at our website. We did a survey of applicants coming in. We asked them what they thought of it. And then we updated the website. And then the following year did another survey and saw that there was an enormous improvement in what it was. And so updating your website, making sure that you have access to the trainees who were there before, who recently graduated, and the ones who are currently there, so you can interact with them, contact them, reach out to them, and talk to them. The other advice we gave programs was to have a meet and greet that is via Zoom. It's not ideal, I get that. But we had our meet and greet when we did our webinar or our web-based interview last spring. And what we did was the faculty were on there for the first 20, 30 minutes answering questions, and then we got off. And it was just my trainees on there alone, the applicants talking. And next year, what we may do is have breakout rooms. So if you want to talk with a faculty, there's a couple of faculty in this room, the thoracic ones. Maybe there's a couple of cardiacs over here. Mm-hmm. Maybe the trainees are over there, and you can leave the room and go into the breakouts so that you can talk just like you would at a cocktail hour, right? You would drift over to another conversation and drift over to another one and get input. So I think there are ways to do it. Is it going to be the same? No, it's not. But there are going to be ways to try and sort of substitute for that. Watching social media is another way. You can see some programs will advertise on social media, their program and highlight it. But it is going to be a little more challenging to fill that hand-to-hand sort of thing. The other one, I guess, is talk to the coordinators, especially about the living arrangements. The coordinators frequently understand what the living environment is like, especially for individuals who came with spouses, and how hard was that and how easy was that?
Yeah, and I think that's a good point that you mentioned there, and I'm going to fire this over to Dr. Lawrence, especially as you've kind of navigated this recently. What was the best way to use social media? How were programs, kind of ramping that up? I know at least where I'm at, we didn't really have a lot of social media presence until it was kind of obligatory to get people interested in the programs.
Yeah, I think the programs that did have social media, it did really help in order to give you more exposure to the program. I think what really helped me during the process as we transitioned to the more virtual formats was the resident meet and greets. I thought were really helpful. When the programs had those, it really gave you an opportunity to really assess the culture of a program, I think a little bit better than the more formal Zoom interview days. And then I tried to always take advantage of when programs offered the opportunity to then have subsequent interactions with residents. So frequently what would happen is, you would have your Zoom interview day, maybe you would have a breakout session with the residents and maybe you wouldn't. But a lot of times the program directors or the people that you were interviewing with would offer you an opportunity to have follow-up conversations on a different day with residents or fellows that might be interested in similar things to you. And I really tried to take advantage of those opportunities. I thought that those actually ended up being the most important conversations I had, because those one-on-one conversations with the current trainees really gave you a lot of insight into the culture of the program, those little important intangibles like you were mentioning before about where do people live, what do they do, how well do the trainees get along with each other. I thought that those were really kind of key elements and important to take advantage of in the virtual setting where you do sometimes miss out on those more intangible variables.
Yeah, certainly that is that's a really good point. And Dr. Lynn, how does an applicant go about assessing culture and surgical experience virtually. I mean, right? So you can reach out to some of the fellows and have some separate conversations. But any thoughts on how to get the real truth, Ihan?
Yeah, I think that is something that a lot of applicants are missing, and I think the best way to do it is actually just directly ask whoever you're interviewing. And it's okay to ask the same question to multiple people, because then you can see, you know, are they consistent? If you ask a trainee, what is your relationship like with your attendings? Do the attendings then say something quite similar in the opposite fashion? And I think, you know, figuring out if there is consistency within different interviewers really helps. I think another thing that, you know, is important to do with these virtual interviews is that there's nothing really that sticks out anymore, because you're just on a computer, you know, you can't see what the building looks like. You can't remember. That was the one where I almost missed my flight because there was a terrible snowstorm. And then you can't compare notes with your fellow trainees that are interviewing with you. And I think that was something that was really helpful for me, is comparing notes and talking to different people about what our experience was like and seeing if people agreed with, you know, how we felt about different programs. So I would say one way to combat that is after every single interview, just write down notes immediately. And I sort of created a spreadsheet where every program I would write notes about the same thing, so that at the end, when you're done with your interviews, you can actually objectively compare them. And, you know, you don't have to remember, you know, that was 3 months ago. I can't even remember what my interview was like or how I felt about the culture. And then it's always a good idea, if you're interviewing with people that you knew from medical school, or if you have a colleague in your program that's interviewing at the same time, you know, always follow up and talk to each other and make sure that everybody's on the same page. And I think that's one way to sort of combat this virtual setting.
So Dr. Lynn, I think that's a great point that you were making, especially about kind of objectively finding little pieces of the puzzle, you know, that were consistent amongst people. And I think that goes to the real basis of what we're doing with these days, where we're interviewing the place as much as they're interviewing us. And so I'm going to ask Dr. Patel, you know, the big question is finding the right fit. And, you know, what are those 3 questions that you find in kind of the new paradigm that are going to be the most important questions to ask to find the right fit?
You know, getting at the culture of the program is always the biggest thing. You want to find somewhere that you feel comfortable, where you trust that the attendings will have your interests in mind, and everybody has different priorities and what they're looking for. You know, some people want to go to a program where they will have a really close working sort of friendship with their attendings. And some people want to be driven, you know, to their limits and get pushed as hard as they possibly can. And so I think just asking those questions over and over again, like Dr. Lynn was saying, to see, for, I guess, lack of a better phrase, who doesn't toe the party line, and who may sort of show their hand a little bit more about what really that program is like and what that program is all about. You know, I never had a set of go-to questions that I particularly asked, but some of the more interesting questions that I always heard, you know, everybody always talks about autonomy in the operating room, and we all want to know that. What do you get to do? How independent are you? And you get this whole range of answers in response to that. But I think one of the questions that I heard in one of the group sessions was asking more about kind of how, especially in the setting of cardiac surgery, how is the conducting of the operation happening? You know, is it being done by the attending? Is it being done by the fellow?
Sure.
You know, how long are the attendings there and present and hawking over you, and those types of things. And then kind of beyond that, most of the rest of my questions that would have gotten at culture were really directed at the fellows, some of the residents that worked closely in that and around that program, and would know it better and maybe able to give you a sort of outsider's perspective of what they saw out of the fellows and their dynamic with the attendings.
Yeah, I think that's important. And I guess if you have any contacts at that institution, whether it was a junior resident or someone that's worked in the system a little bit and could give you kind of a fly on the wall view of the program would be very helpful. That's actually a good segue. Dr. Vaporsian, so networking is critical to finding jobs, to matching into fellowships. But this year it looks like we're heading towards another year without in-person national meetings. Those little you bump in the hallway, run into somebody, make a connection. So what any thoughts or suggestions on how to do networking in a virtual world, especially for applicants that may not have a cardiac training program at their institution, so may not have easy access to mentors?
So the question is more about mentoring in search of a fellowship, not mentoring in search of a job.
Right.
Okay. Yeah, again, just as we talked about fairness across an entire country with widely disparate rates of COVID and rules, the same applies to doing rotations electives, right? Which has classically been a way to get your foot in the door, especially for those individuals who don't have access to a cardiothoracic training program in their own program. The American College of Surgeons, plastic surgeons, a number of groups have stepped up and made statements that, look, in order to keep this fair, we're going to have to curtail this, or at least tell you to stay in your city. All right. So if locally, in your state, there is a program that has a cardiac track, or even a private practice group that you could go shepherd and watch or something like that, that would be the way to do it, to develop at least the idea in your head that, yeah, I do like this. This is something I want to do for the rest of my life. The ability to target a program across the country is going to be difficult this year. That being said, there are ways to get access to those programs and make yourself be seen and heard. One thing that we talked about as well in the TSDA conference the other week was the idea of asking if they have any virtual conferences that you could attend. Mm-hmm. For instance, we do our journal club nationally now, and anybody can jump in, and we advertise it on Twitter, and we've had 140 people listening into our journal club last month. Are you going to be able to get the same attention that you would if you rotated here for 6 weeks? No, you're not. But you'll get to be seen, and you can maybe ask a question in the chat box, and there are ways to get noted from that. Similarly, I think reaching out to faculty and offering to do research during your training. Doing clinical research does not really require being directly in that access, right? You can get access to the chart and data in a controlled fashion. You can do it. We have a clinical research fellowship. None of my clinical research fellows have been on site at all since April. They all work from home. One of them had her baby at home and continued to publish, all right? So it's fine, you can do that. And you could do that. There's no reason why it has to be in the same city. It could be across city, across state lines, and you could be doing research projects with another faculty member to get that access, make yourself available. So those are some of the ideas that crop up. We're gonna have to get creative, unfortunately, or fortunately.
Yeah. So luckily we've been fortunate enough to have Dr. Carpenter join us. She is the program director at UT Health in San Antonio. Thank you for coming on with us. And sorry to bombard you with a question as soon as you get on, but I think you made a great point there about communicating with programs in this world where we aren't at the national meetings and we're kind of having to target. What are kind of the rules of engagement with the programs now that we're on a little bit different playing field?
Well, I think those of us who are involved, certainly in the administration of residency programs, are very open and available to respond to emails, do this sort of activity. Of course, as you can see, we are not the master of our schedules. I just got out so that I could get on this meeting. I would say you should start out by taking a look at what's on the ACGME site about programs and on the TSDA Thoracic Surgery Directors Association site. Think about the programs you would be most interested in, and then, contact them directly. Tell them a little bit about yourself, tell them about what you're looking for, and ask them some questions. And do that as you're preparing your applications. And we're trying to get into the 21st century here in terms of being effective at getting on Zoom and doing things like that. I know a lot of programs are doing similar things, and we're going to have a couple of meet and greet programs, try to give people an idea of how to get to know us. And then, put your applications into the programs you think you really are most interested in. I think you can get a lot of feel just from conversations and email traffic with programs. Probably the most important thing is to have time to talk to the residents that are active and in the program, because they're the ones that are going to be honest with you and get a chance to chat with them about why they're there and what they like about it and whether they recommend it. And then, don't just think that now that you're not traveling, you've got to interview at every program in the world. You've got important things to do in your fourth year. This is your last opportunity to learn things you're not going to get a chance to learn again. So, since you don't have to spend the year on airplanes trying to interview at every program that you can get to, be sure that you get in some non-surgical things that, believe it or not, are really important to a cardiothoracic surgeon. It's not just all cutting and sewing. You've got to understand how to take care of patients, how to make good decisions about who to operate on, what operation to do, what operation not to do. So there's kind of a mixed blessing that there's no away rotations and there's no in-person interviews. But on the other hand, there are advantages to it. And don't fret. Everybody's on the same playing field. I mean, we're not having any visiting students this year, and neither are any of the other programs. And we're all figuring out how to communicate like this, and slowly getting functional at it, especially those of us that are a little older and been at it for a while. But, don't let everybody drive you crazy thinking that you're just out of luck because you can't run around and interview, and try to apply the same things that you would to anything you choose to do. Think about what's important to you. Is what's important to you spending time in a research lab where you can come out and be a surgeon scientist that spends 3/4 of your time funded by NIH and doing research? Well, there's programs where you can do that. If what you're looking for is being a really competent operative surgeon, then you need to look for programs where you get a good sense that the residents do a lot of operating and get a lot of skill. And you can still get all that information communicating with people like this. Is that helpful? Other questions?
Yeah, no, thank you. Thank you, Dr. Carpenter. I think that's all very thoughtful point. And the one thing I would like to add a little plug for, the TSRA is putting together a centralized website with a lot of the information that's on the TSDA website and the ACGME website, as well as links and information shared from the programs. We're sort of piloting this through the I-6 interview process right now. So by the time you folks are applying for fellowship later this winter, it should be full blast, and all the programs will hopefully have information and links to website, links to content up in a central location on the TSRA website. So I think this is another good segue. Dr. Moser, the old adage, turn every obstacle into an opportunity. Any thoughts on how applicants this year can turn this unique obstacle of virtual interviews into an opportunity to actually get more out of the process?
That's That's a great question, Hunter. I think when I was going through this process, the biggest barriers were the fact that times and dates for interviews were often stacked such that you couldn't go to multiple programs. And maybe there was some sort of gamesmanship amongst the programs to sort of ferret out who was interested in which place. We don't know. But you have an opportunity in this setting and in this climate to investigate almost every program. Dr. Carpenter mentioned you can simply send an email to programs you might be interested in, and they're probably going to be pretty receptive to that because the programs need to fill their spots, and they need to fill their spots with candidates that want to be there. So I would say the playing field is leveled from that standpoint alone. Not to mention the fact that you don't have to go out and spend tens of thousands of dollars flying all over the place and, you know, upset all of your co-residents because of your absenteeism. So I think the barrier to entry to most of these places are lowered. And I think that having these venues, if you ask a sharp question, you might stand out pretty easily. Versus if you're in a crowded room and it's noisy and people are, you know, jumping from conversation to conversation, it's a little harder to differentiate yourself every time. So those are kind of the two things that come to my mind.
Yeah, I think those are really good points, Tony. And as you know, that's a more glass half full type of answer. I'm more of a glass half empty type of person by nature. So Dr. Lynn, what are the parts of this that are lost in the virtual interview? What are the components of that interview that you just can't replicate by doing it over Zoom?
Yeah, I think this comes back to a little bit of culture and fit. You know, I think one thing that really helped me was seeing how the attendings interacted with each other and how the residents interacted with each other, and how the attendings interacted with the residents. And you can tell that, you know, when everybody comes together for lunch or meets each other in the hallway, you can kind of see, you know, what sort of relationship the attendings have with their fellows. So I think that's something that is lost. And again, I think, you know, a way to combat that is to ask these questions directly and make sure that if someone says that they want, or they're willing to answer questions after the actual interview, that you take them up on it. And I certainly did that, even though I went through all of the in-person interviews. If there was a program I was very interested in, I definitely took the residents up on that and asked them more follow-up questions. You know, actually going back to one of the things that Tony said, which is, you know, asking the questions, I think there's less opportunity to ask some questions that maybe are not the make or break of how you would decide. So for example, you know, we had some residents interview, and they were asking about things like, you know, does your program cover money for loops, or do you guys, you know, have paid parking? Those are certainly affect your daily life, but at the same time, if they're not something that will change your mind about a program, I would say maybe skip it and ask that later on. You know, if that's really a very small opportunity you have with each person, because you're not walking down the hallway sort of on that tour with the residents, that you can just ask these questions. It's very precious time now that you have. So I would, you know, still be free in asking whichever questions you want, but maybe think a little bit about what are some make or break questions that I definitely want to make sure I cover during that time.
Yeah, no, I think going into the interview prepared is certainly key. I did want to circle back to one other thing that Tony brought up. Dr. Carpenter, maybe from a program director standpoint, you know, with potential scheduling conflicts, you know, in a virtual format, in theory, it's easier to line up more dates and around various times. Do you anticipate that a lot of the fellowship programs will offer more interview dates, or you know, be more flexible if, you know, you're perhaps not available a certain date or time, or how do you think that will affect the availability?
No, I think she's muted. Dr. Carpenter, I think you're muted.
There we go. Sorry, I muted because my phone's firing off, even though I'm not on call. I think that you know, programs schedule times to interview based on what works in with their schedule without disrupting operative schedules, clinic schedules, and residents' activities. At least that's what we do. And you know, we typically interview 20 to 24 applicants a year, and try to pick residents or applicants that, from whatever communication we've had with them and what their personal statements have to say and what the letters have to say, that we think are looking for what we have to offer. So we're probably not going to offer more interviews than we have in the past, because really, I think the goal both for the program and for the applicants is to find a good match. And there's no reason to waste your time if clearly what you want in a residency is not what we have. And so we're not going to make that change. And I suspect most program directors are going to feel pretty much the same way about it. And like I say, you know, this is a real opportunity for the people applying to integrated programs to, you know, use a little bit more of their fourth year to learn things and be a little better prepared to start internship instead of stressing themselves jumping on an airplane every week. I remember when I was interviewing for thoracic residencies, I got down to my last interview day and my bag was packed and I was in the shower, and I got out of the shower and I said, I just can't face getting on another airplane. So I put my scrubs on and went to work. And my partners, my fellow residents, were all delighted that I did that. And you know, for the folks that are going to be, that are in general surgery programs and are going to be applying to the post general surgery traditional programs, it's kind of the same thing. You know, you don't have to run all around the country, but that doesn't mean that you need to try to apply to more programs. More doesn't mean better. You want to look for programs that to the best of your ability to discern, from this great site the TSRA is putting on, from the program sites, from talking to people on the street, the ones that offer what it is you're looking for, because we're not all looking for the same things in a career. There's a great breadth to being a cardiothoracic surgeon, and you want to spend your time and energies trying to appeal to the places that you think really offer you what you want. So your job one is figure out, what do you think you want?
No, I think that's a great point. You know, kind of take what you want and picking that list, you know, and I would fire this over to Dr. Lawrence, you know, so you've got your list, you've got the interview, you know that this is a place that's high on your list. What are the top few things that you have to do to really ace that interview? And what are the few things that you really want to avoid?
Yeah, I think that the most important thing, if you know that this is a program that is going to be in your high up on your rank list, I think you have to let the program know that. Because like Dr. Carpenter was saying, I think that programs are looking for a good fit. They want a resident in their program that wants to be there. So I thought it was really important to, you know, you want to be honest with programs, but if you really want to go there, I think it's important to let them know that you want to go there and you would be really happy to go there, because, you know, you want to know that it's a good mutual fit. So I thought that was really important. I think that it's good to let them know, you know, a little bit about you on a personal level too. You want to make sure that, you know, it's going to be a good fit from a culture perspective, like so many others have said previously. In terms of things not to do during a virtual interview, you know, I think that as we started to transition from the in-person to the virtual interview, it became really challenging to schedule them, right? Because when you go on an in-person interview, you have the whole day off, you don't have any commitments from the hospital. And when we started to transition to these virtual interviews, it became really easy to, you know, you would leave the OR for a little bit, go to your virtual interview, but your phone might still be ringing, you might still be getting paged. And I think that's a definite no-no. It's really easy to be distracted during the virtual interviews. And so even though like you may just be in your apartment, you may be in your call room, you may be in your residency office, like treat it like a real interview. So really disconnect from your phone, disconnect from your email, you know, make sure that you have your clinical responsibilities covered so that you're not tempted to kind of look away at your phone, because I think that stands out. You notice when your interviewers do it, and so they definitely notice it when the interviewees are doing it as well.
Yeah, no, I think that's a really good point, and something that actually came up in our last webinar, talking about interviewing for jobs as well. You know, when you're going to set a time for an interview, you really need to treat it as if you're going to be there in person, and you know, dress the part, and fully dedicate your focus and energy to that. Maybe Dr. Patel.
Patel, did you have something to add?
Yeah, I just wanted to, if you have a second, I just wanted to build on what Dr. Carpenter said.
Yes, sorry.
I cannot underemphasize enough how important what she said is. It's the same advice I give my fellows as they're getting ready to look for a job. Not only do you have to sit down and take the time to reflect on what it is you want out of your career, but you have to write it down. Because the minute you go to that first interview, whether it be for a job or a fellowship, everything is going to look so amazing. And they're going to tell you about stuff, and you're going to go, wow, that is so, I so want to work here. And all that ranking that you did will go out the window. Because the first thing you're going to hear is, oh my gosh, they let you do that. Oh my God, they got that rotation. That is so cool. So unless you really commit it to paper and commit that this is what I really value, you will quickly find yourself being pushed by the winds of a good salesman. And remember, the programs want to fill, so they're going to be selling their programs to you as well. So take the time, reflect, write it down, and then it also makes you look better when you ask questions, all right? You know, when I ask somebody what do they want to do in their career, and they tell me, oh, I want to be a master clinician with a lab who does clinical research, and one day I want to be chair. All right, come on. All right, you're not going to be everything. So tell me what you really want out of your career, and then ask me questions if I can help you get that. That makes me think a little bit more about you, like, wow, this person actually thought about things before they walked into my office. So I can't emphasize what AJ just said. I mean, that is crucially important. Yeah,
really have to know yourself before you go out there looking for the right program, the right fit. And that's one of the advantages of the general surgery and applying to the traditional program, is you have had a few more years to learn yourself and learn who you are and what exactly it is that you want. I do want to just take this chance to remind the attendees that you can submit questions through the chat box, and we will answer those live. Have a few more sort of pre-written, pre-submitted questions. Actually, something that came up earlier, I think, Tony, you were talking about, you know, how important it is to maybe it was Jihan, ask a good question during the group virtual session, and try to set yourself aside or make an impression. So, Dr. Patel, how do you show your personality and leave that positive impression during a pre-interview session without asking in front of everyone how much vacation you get, or whether you have to walk in the rain from the parking deck?
Honestly, I found it next to impossible in the virtual setting. In that transition from the in-person interviews over to all of the Zoom ones, I thought that was where everything fell through the most, in that night before social hour where you kind of have informal conversations, talk to some attendings, talk to some fellows. When everybody's there on the Zoom meeting, I mean, you guys all know we're all surgeons. We all have that same personality. Everybody was probably a gunner for 4 years in medical school, and everybody knows that they need to say something or do something to stand out. And so there was a constant battle for attention in a lot of my interviews, and a lot of people who were speaking up with a lot of, you know, the same questions, but you know, making sure that my box pops up when my voice is speaking, and I'm holding court for, you know, 10 to 15 seconds so that everyone sees my face one good time. It was frustrating and really difficult in that setting, to be completely honest with you. And I tended to focus most of my energies on showing my personality, setting myself apart in the individual interviews. Like I would do in a normal interview, you know, having done research on the people on the program's websites, having questions that I thought were relevant to me in my career, that I found interesting from things that I had read. And then, yeah, just, I don't know, this one's probably harder to just being good at interviews.
Yeah, I
Let
think
me
that's
just say, whether it's virtual or in person, be you. Don't try to impress based on, you know, what you learned about me from the internet.
Right.
We want to know who you are.
I think that's a really good point. You know, trying to be true to yourself and portray that in the virtual sense is certainly sometimes difficult. I'm going to open this question up, actually. It was
Can I
based
make a
on,
point about that too? I was talking to a few attendings, you know, in preparation for this, to you know, asking about that question. And I think one thing to also be careful of is not take this too casually, because I think sometimes in the virtual setting, you know, maybe you want to seem a little bit more relaxed and a little less intense. But I think, you know, when I go into any interview, I always want to make sure there are, you know, for example, 3 things that I want every interviewer to know about me by the end of the session. So doesn't mean you have to, you know, be that annoying resident that is always taking up everybody's time. And again, this is not really something you want to do in a group setting. But make sure that you don't, you know, sort of become too relaxed about it as well, because, you know, I think that's a tendency sometimes when you're doing the virtual interview. And I will say, you know, this multiple people setting, it was also present even with the in-person interviews. You know, you'll sit down at a table with 1 attending and 4 residents. And so that kind of situation always, you know, somehow still pops up.
I'll take the counter
Sure.
argument, Yihan. It's really easy to get uptight in these too.
Yeah.
You got all these boxes of candidates that are, you know, your equals or have differentiating capabilities that maybe you do or do not have. I would agree with Dr. Carpenter. You have to be yourself and chime in when you feel like it's a good time to say what you feel like you need to say, and you know, not be too stiff either.
Agree.
I think those both really good points there. The question, I think, you know, Dr. Lynn kind of alluded to it a little bit, and certainly Dr. Lawrence earlier, and I'm going to open this up to the whole panel here and kind of get both sides of the perspective from the more program administrator side, and then kind of our colleagues. Is, I think the big thing we talked about is treating this like a real interview and not having those clinical responsibilities. You know, what is the approach to kind of communicating the importance of that to your program leadership, but also communicating that to your colleagues, because that's a very different conversation with 2 very different sets of people.
I think it's important, you know, that's very dependent on your culture, your program too, but it's important to let your colleagues know that, you know, you'll take care of them and they'll take care of you. And you know, luckily, you know, in my program, everybody was very good about that. You know, we never let anybody feel bad that they were going to an interview. And obviously, you know, that's not the case at every program, but I think letting your colleagues know that when it's time for them to interview, that you will also be respectful of their hours is helpful, so that they know that you also have their back.
I'd like to hear what our applicant pool here thinks about all of this. What questions or comments do you guys have?
You guys can just type in the chat box, and we'll be able to respond. We can discuss any other questions you guys have.
I'm not seeing any chat at all, so maybe that's not working. I don't know.
Yeah. As a reminder, this will be is being recorded and will be posted on YouTube, on our TSRA YouTube channel for those that are unable to make it tonight.
So one question just popped up on the Q&A. I think they only.
Oh yeah, the Q&A is a little bit separate there.
Yeah, not to the chat box. So thank you for this really informative conference. I wanted to ask a question from the panel. How not matching into a program last year and reapplying this year affects your application, and what's the group's suggestion for reapplicants? Thank you.
I would say that if you didn't match last year, if you want to apply back to that program, I would try to have a frank conversation with the program director about, you know, why you didn't match. Is it because they loved you, but they only had one spot and they had somebody they loved a little more, or an in-house candidate? You know, I wouldn't say it's impossible to reapply and match, but if you didn't match last year and you ranked them at the top of your list, then probably shouldn't spend your #1 match on them again. That old adage, doing the same thing over and over, expecting a different result, I probably would look to other programs and try to seriously consider what there was about that program that you may not have been a good match for, and how you can find a program that's a better match.
I would say if I were a reapplicant in this setting, I would try to use the opportunity of the virtual opportunity here to try to apply to other places that you may not have thought of to go because you couldn't get there, or you know it was a bad time for their interview date, and try to use this as to your advantage.
And don't give up. I will confess, I didn't match the first time I applied to thoracic surgery.
There you go.
But turned out okay.
And I would not dodge it. Don't hide
Yeah.
it. I put it right in your personal statement. So I applied last year. I didn't make it. This is what I've done with what I've learned. This is why I really want to apply. If any of you have read about grit, grit has a lot of value. You know, reapplying doesn't mean you couldn't do it. It also shows grit, that this is something you really want. And there's a reason why surgical fellowships and residencies are attracted to athletes and musicians. It's because they have grit, because they work hard with the goal. And so, yeah, so reapplication doesn't mean anything, but don't dodge it. Don't act like you're embarrassed of it. Just say, you know, I tried. I obviously put together the wrong rank list last year, and I spent the year learning X, Y, and Z, and I'm ready to go, and this is what I really want. I'm not going to shy away from it.
Yeah.
I think that's a huge point that you're making there, and I think that's part of their narrative. Just like Dr. Carpenter, you know, freely said she didn't match. You know, you have to own that. That's part of being true to yourself. And I think you're right. I think a lot of programs will take that, you know, kind of at face value more than, you know, a scarlet letter.
Mm-hmm.
If there's nothing else in the Q&A right now, I do have one other question. So I must admit that through the COVID pandemic, I became a little bit more social media literate and got a Twitter account and everything. And, you know, it actually helps to promote some of these TSRA events. And I have learned that there are some people that are very active and talk about lots of things and upcoming events and cases they've done and sort of promote themselves. Dr. Lawrence, maybe I'll throw this one to you. Any thoughts on, you know, is that important in a virtual world where we have to make an impression through the computer screen to have a social media presence?
So I did not really have a social media presence. I think I was kind of a late COVID adapter like yourself. I picked up Twitter, you know, during the dark days of COVID, and I really enjoyed it, but I think it affected me during the interview process. You know, the fact that I was not, you know, self-promoting everything I'd ever published on Twitter, I think was just okay. You know, nobody asked me about like how many Twitter impressions I had during my interviews. I'm sure that if that's something that you do and you are very skilled at promoting yourself, that would help, but I don't think it hurts you if you don't have a big Twitter presence.
So there's one more question coming from the Q&A here from Raymond Lopez. It's kind of a two-part question for the whole panel here. How quickly do you foresee more programs updating their social media, websites, and online presence in general? And then what adaptations to the COVID era are programs likely to keep beyond the pandemic? So do we think this is here to stay, or do we think it's kind of a flash in the pan?
I'll just say our journal club will stay online. Our weekly didactics will stay online. We have residents scattered in a couple of different hospitals, even though they're in the medical center. It's still a pain in the butt to get from that hospital over there to this hospital over here at 6:30 in the morning. So I have no doubt that we will maintain a number of activities online. The interviews, I don't know. For all the reasons that have been discussed today, I feel bad that the applicants just can't come here and mingle and learn and meet us. By the same token, though, I feel good about the money I'm saving y'all. So, you know, it's sort of a mix, but we will definitely keep those. There was a two-part question. I would hope after our TSDA general session 2 weeks ago, they are all updating their websites. So they got an earful about how valuable that is. But I can't answer for programs.
You know, some programs are better at it than others. I mean, I have actively avoided things like Facebook for years. I feel like I need a little bit of privacy in my life sometime, but I think that this is here to stay. We're really trying to make our web presence better. I still haven't figured out how to actually tweet very effectively. It seems like every time I see some tweet that I want to respond to, it goes astray. I don't know what the deal is, but I'm working on it. But I certainly hope we'll get back to in-person interviews, because there are aspects of that you just can't beat.
Yeah, no, I think I would agree with that. And what I will say is, once we sent this invite out to program directors to send us information and their social media, you know, links to their social media, it was slow to roll in, but things have certainly started rolling. I think as the I-6 application cycle is sort of upon us, things are getting updated more aggressively. And now looking forward into the winter as the fellowship interview process gets rolling, hopefully a lot of those processes will be in place. I'd like to take the opportunity to thank all of our panelists again. Any final thoughts, or we have just a couple minutes before the time is up.
See one more question.
There's one more Q&A here, and I think it comes from Miriam Martinez. We answered a little bit of this earlier, but I think it would be worth reiterating here. And she asked, which characteristics from the pool of applications that you looked at for folks when you're inviting for interviews, what are those big characteristics? Will those change now due to COVID? and meaning applicants that don't come from programs with a cardiac surgery fellowship or letters of recommendations from well-known CT surgeons, et cetera, et cetera?
I'll just say that by and large, we don't have intent of changing our desires for who we do want to interview. But we also, we've always been kind of open to the reality of where people come from. Not everybody is coming out of programs where they had a great deal of exposure to big name cardiothoracic surgeons. And, of our 3 residents right now, one came from a little town in North Dakota where they didn't have cardiothoracic surgery. 2 came from the Quinnipiac, I probably said that wrong, relatively brand new medical school. Our current 3rd-year resident was one of their first ever graduates. It's really an issue of we're looking for people we think want to do what we are prepared to teach them to do. And I think that's true of every program director. And so you just need to try to, most importantly, as I said, as R really reiterated, take an honest look at what it is you think you want in your career. You're young, you can change, but think about what it is you want in your career, and then try to find programs that appeal to you. And you be honest with them, they should be honest with you, and it's ultimately gonna work out. The ratio of applicants to integrated programs for positions is very difficult. I'm going to be straight out. That's not a big surprise to anybody that's applying to those programs. And so you obviously also need to consider programs that head you down the traditional route. And for those people that may be on the call that are in general surgery programs and looking for fellowships, the ratio of applicants to positions is much more favorable, but don't be unrealistic. Go for what you think you really want, and you be honest with programs, and they'll be honest with you.
I think that's some really good advice, and that might be a good closing take-home statement. So thank you again, everyone. Thank you for your time. And as a quick reminder, these will be posted on our YouTube channel for those that weren't able to make it. Thank you.
Bye-bye. Sorry I was late.
No worries.
We're not the master of our schedules, are we?
Nope.
Not even a little.
Bye-bye.
Bye-bye.